Good afternoon, everyone. Welcome. Thank you so much for joining us today. My name is Leslie Babinski, and I'm the director of the Center for Child and Family Policy and the School Research Partnership, which is part of the Sanford School of Public Policy at Duke University. I welcome all of you to this really important discussion focused on using data to advise school systems during this pandemic. Today's discussion will focus on the work of the ABC Science Collaborative, which is coordinated by the Duke School of Medicine and the Duke Clinical Research Institute. The collaborative pairs scientists and physicians with school and community leaders to help them understand the most current and relevant information about COVID to support their decision-making about in-person schooling. I'd like to start by introducing the co-chairs of the ABC Science Collaborative. Dr. Kanecia Zimmerman, Associate Professor of Pediatrics, welcome. And Dr. Danny Benjamin, Distinguished Professor of Pediatrics, both from the Duke University School of Medicine. Welcome, Dr. Benjamin.
Thank you.
It's my pleasure to also introduce today's panelists. Dr. Nakia Hardy is the Deputy Superintendent of Durham Public Schools. Welcome, Dr. Hardy. Ms. Cathy Moore is Superintendent of the Wake County Public School System. Welcome, Ms. Moore. Dr. Amy Fowler is a pediatrician, an Orange County Commissioner, and a former Chapel Hill-Carrboro City Schools board member. Welcome, Dr. Fowler.
Thank you.
And then our final panelist is Professor Stanley Litow, a member of the New York City Education Sector Advisory Council, which is a group charged with advising the New York City mayor on reopening New York City schools. In addition, he's a professor of the practice here in the Sanford School of Public Policy. Welcome, Professor Litow. Thank you. So today, the focus is on the ABC Science Collaborative and how they're working with school systems across the state. So we're going to start with Dr. Zimmerman and Dr. Benjamin. And as participants, you could submit your questions through the Q&A function at any time. And as we finish the panelist discussion, we'll be reviewing your questions to ask as many as we can near the end of our session today. So Dr. Zimmerman and Dr. Benjamin, thanks again for joining us to talk about your work with school districts, such important work that you're doing. And I'm pleased that we have this opportunity to hear from you about how this initiative got started, what your goals are for the collaborative, and how you work with school systems. Dr. Benjamin?
Sure, thanks. So in mid-July, I got a phone call on a weekend from Amy Fowler, and Amy and I had known each other from a couple of different modalities. And she said, I really wanted, she should tell what her thinking was, because I've told this story before, but it was all got kicked off by Amy and her vision for what she thought might be good for schools. And my response to her was, hey, I don't think you want to focus on metrics. That was one of her questions. I don't think you want to focus on the community metrics. The science here is going to be emerging rapidly. I think you're going to want something like, if we were running some kind of advisory sort of group that really is focused on data and emerging science. And that really spoke to her. And so we got off the phone after about 20 minutes, and I called up KZ, and Kanecia and I had been doing some other research for schools, and is often the case between the two of us. I'll be like, I just got off the phone, you got to hear this, you got to hear this, you got to hear this. And as is often the case between the two of us, she's like, okay, pal, just let's think through this a little bit. And between us then, within 2 or 3 days, we'd scoped out kind of a one-pager for Chapel Hill City Schools on really what would become the ABC Science Collaborative. And once they picked it up, Orange County, Wake County, Durham, all within a week, really asked to be a part of, and it's really taken off from there. KZ, I think you're up.
Great, thanks. I have a couple of slides just to share with you kind of what we've done over the last several months now. The time has really flown by because there's been a lot to do. But as Danny mentioned, our collaborative is really to join science in schools. We got into this arena and quickly realized that there were going to be a lot of questions that people had. And that questions from parents and teachers and principals and superintendents and even students were going to be highly varied. And they were all going to be about COVID-19 in general, but also about like how to keep themselves safe, how to keep their families safe, and really what to do and what things they needed to be afraid of, and quite frankly, what things they actually didn't need to be afraid of. So we saw it as a welcome opportunity to really answer some really important scientific questions. As time has gone by, what we've also learned is that the landscape changes really quickly when you have an emerging infectious disease. And so not only are there questions about safety, but then questions about vaccinations and what about rising cases, et cetera. And so this has also become part of our purview. And we've been very, very happy to really help out to make sure people had the most relevant and current information about COVID-19. We did receive some seed funding from the National Institutes of Health, and we have a team of really dedicated scientists, public health scientists and physicians from Duke Clinical Research Institute, and the University of North Carolina School of Medicine, who are very invested in public health and safety. We have really three aims to our program. The first is informing evidence-based decision-making. So making sure superintendents and boards and people who are making decisions actually have appropriate information, actual data to make those decisions. We've coordinated with state and local health departments, and we've actually had a lot of interaction and collaboration with stakeholder groups such as the teachers' organizations. Initially, we thought this was going to be kind of a quick fix by educating people. If we could just educate them, everything was going to be fine. And so we created a number of resources that are now publicly available, anything from like masking to like how the virus works and how it actually attaches to cells and things of that nature, all available in Spanish and English on our website. But then it became clear that additional questions really needed to be answered. So we developed a mobile application and a dashboard that really helps to schools to function when people kind of get back into the classroom. So keeping track of who has symptoms, who has a positive test, how long you should be out for quarantine, and increasingly now, what about vaccinations and who's been vaccinated and who hasn't? So the ability to manage a classroom as well as ask important public health questions directly of families. As Danny mentioned, we started with 4 districts, and we've kind of ballooned since then, and covering areas across the entire state, which has really been very enlightening because people are doing things a lot of different ways. We have a number of people from our team who are very closely engaged from the mountains to the coast. We've also had some support of charter schools. It seemed that once people started hearing about this, and everyone really needed information, which I think just goes to show like this is really an important problem to solve. And then a number of existing partnerships with stakeholder organizations. We've collaborated a lot with the North Carolina Department of Health and Human Services, the National Institutes of Health, members of the AAP, the North Carolina Association of Educators, and the NEA. We've also, people are having this problem all across the country, it turns out. And so a lot of collaborators across the country trying to think about how to do this in a standardized and uniform way and to make sure that schools really have the information that they need. We have been successful in our kind of the immediate 10 months, I guess, if you call it that. We've had some people successfully return to in-person learning environment. We've also had some interaction with the CDC and to show them data, to show them our data, and to talk to them about actually what we're learning on the ground. It's one thing to kind of be a legislator and someone who's thinks they know kind of what's going on, but then it's a total other thing to kind of hear from, well, can they actually implement that as a school? So those were some of the things that we were actually telling or talking to the CDC about. And as a result of some of our interactions, the CDC did make a prioritization of schools back in December. And then more recently, many are familiar with their position based on the data that schools can in fact open with mitigation strategies in place. As part of this process, we've also developed 12 principles for reopening and then some school-specific metrics to evaluate school and district performance. I'll turn it over to my colleague, Dr. Benjamin, to talk some about the data that our collaborators here in North Carolina have helped to generate.
Great, thanks. So when we looked at this, we thought the key deliverable really is preventing transmission of infection at school. And that's really what we've got to do here. And we got 11 school districts to start tracking infections, and the local health departments said, all right, is this either a community acquired infection or a school acquired infection? Because during COVID, children and school staff are going to come to school with infections. The key thing is to prevent people from infecting each other while they're at school. And one of the things that's been lost over the last month as our research has gotten more public attention is that the superintendents met weekly with the ABC faculty, not only to share lessons learned, but to do course correction whenever there was secondary or within school transmission of infection. Go ahead, thanks. So the 11 districts are here, 9 of them are county, 2 city. And you can see their primary infections over in the far corner. You can see the students that had received in-person learning. The key point to note, these were the community-acquired infections, so there were plenty of people coming into the schools with infections. And then this represented about 90,000 children and adults. We had 773 community-acquired infection, and that really, the real low, we felt that they were gonna do well. And in the weeks during this time, we were getting inclinations that they were doing well. And we were pretty excited about it because we were talking about how they were doing as they were doing this. But they only had 32 school-acquired infections and no child to adult transmission. Go ahead. So, you know, if you think about kind of the worst case scenario, it would be that at schools for 773 community infections, you would have 900 or even more if these were super spreaders infections. And so really, this is a successful return to in-person learning. It's defined by strong leadership at all levels, whether that's the board, the superintendent, the principals, the teachers within the classroom, the school bus drivers, the parents at home. It's defined by mitigation strategy, and it's not so much the community transmission. In fact, we've seen that that does not predict successful reopening, but rather your mitigation strategies within the school, primarily masking, distancing, and hygiene. Go ahead. Back to you.
So based on the data that we acquired and our interactions with schools, we developed some school-specific metrics. Going back to kind of Amy's initial question, what about the metrics? So one of the most important things we think are really evaluating what's happening within the school and how successful are your mitigation strategies to make sure that if someone does make it into the school building with SARS-CoV-2, that they don't pass it to someone else. And we just created a method of trying to figure out how do you do lessons learned and what should happen if you do have an event that happens within that space. The other thing that we've done is to really create 12 principles for safe schools. Again, this is really in collaboration with all of the districts that have been working so hard. I think it's really important to note, like, there's nothing magical about schools themselves. It's about who's in them, right? It's about who's in them and what they're doing to make this place a safe space. We really think it's really important for transparency to make a roadmap for contact tracing and testing so everyone's on the same page. Develop a dashboard so there's transparency about the cases that are coming into the building, but also cases that may happen because someone comes in contact with someone else and the mitigation strategies were not in place. Implementing lessons learned, working with someone to analyze the data, leveraging specifically school-based metrics, fighting pandemic fatigue. So doing things to cheer people along as we want them to do masking. We want them to do distancing and washing their hands, but we can all do this together. Making a detailed schedule, considering the extracurriculars, and doing detailed schedule even for special needs, making sure parents and teachers and everyone knows what's going on, and then starting slowly, but then escalating as you are improving in your methods, as you've proven to yourself and to others that your mitigation strategies are sound, moving on from the plan B. That is all we have, and we're happy to take questions later in the session.
Thank you so much, Dr. Benjamin and Dr. Zimmerman. Such an impressive effort that you launched so quickly at the beginning of the pandemic. Now I'd like to bring in some of our panelists before we loop back to you with more follow-up questions. But as Dr. Benjamin mentioned, Dr. Amy Fowler was part of the launching of the ABC Science Collaborative. Dr. Fowler, as I mentioned at the beginning, is a former school board member in the Chapel Hill-Carrboro City Schools, as well as an Orange County commissioner currently and a pediatrician. Dr. Fowler, can you tell us a little bit about what those initial conversations were like in launching the ABC Science Collaborative and how you've continued to work with Dr. Zimmerman and Dr. Benjamin throughout the pandemic so far?
Sure, I'd be glad to. Yes, as Danny mentioned, back at the beginning, the North Carolina DHHS and CDC had both provided guidance about metrics for schools to consider, but they didn't actually provide specific criteria for when it would be safe to transition to virtual or hybrid, or from virtual to hybrid or a full in-school model. And so I, along with the chair of the school board, thought we needed a medical advisory board to help us provide, an evidence-based approach to reopening. And so I'm a pediatrician, but I didn't really want to be the sole arbiter of this, evolving medical data. So she and I both reached out to physicians we knew, and for me that was Danny, who then took this to the next level. Reaching out to the local and then extending it throughout the state. So this became something much more impactful than I even had imagined. So and in terms of my involvement, early on, I was involved in the weekly meetings between the collaborative and then the other founding districts, Wake, Durham, and Orange County. And so it was like a mutually beneficial process where we would ask them our pressing questions and then to in turn help them craft their approach to what they were doing. And they would ask us what kind of data, would be most helpful for superintendents and and there they evolved, what they were providing just sort of naturally.
Mm-hmm. Yeah, thank you so much for that background. It's interesting to hear how, as a pediatrician and a school board member, you were kind of called on, to start interpreting real-time changes in data and how complicated that is. So it's an interesting piece of information about how you got involved with this. Can you talk a little bit about when you were on the school board, what were some of these metrics? What were the different sources of information that were most important in guiding decisions?
Absolutely. So yeah, one interesting thing that we realized early on was that the decision was not just simply at what cut point in terms of % positive COVID tests or rate per 100,000 would it be safe to return to in-person learning. But as a school board member, I also had to factor in teacher and staff concerns, parent concerns, and of course, what is best for students. And so the ABC Collaborative had provided the district leaders with the most up-to-date science, but they did, much more than just review the current literature. We realized that not only did they need to, inform superintendents and school boards so we could do decision-making, but they also needed staff to understand and feel comfortable with what our plans were. And so that's when they created the educational webinars. And then they also worked with our districts on creating detailed safety protocols for opening schools. And then finally, I think the most valuable thing has been the real-time data collection from schools in North Carolina on COVID that showed that secondary transmission was low and that rates in schools who were following their protocols, were lower than the rates in the community. So, previously we were just looking at sporadic info from, camps in New York or things like that. And this, now provides us real data that's comparable to what we would be doing, which I think, is, incredibly valuable.
Mm-hmm. Yes, thanks so much. That really does speak to the importance of having access to both the real-time data and the advice. And it reminds me of what Dr. Zimmerman said earlier about the metrics are one thing, but how you actually implement the mitigation strategies are another key important part of all of this. I'd like to bring Dr. Nakia Hardy into the conversation now. As Deputy Superintendent of the Durham Public Schools, I can imagine that you've been engaged in many discussions about the best ways to meet the needs of children and families in Durham during this really difficult and challenging time. And I know that DPS has made the difficult decision at this point to continue with remote instruction for the remainder of the school year. Can you tell us a bit about how you and your colleagues in Durham Public Schools have worked with the ABC Science Collaborative and how you use the information and the data that they've been providing to make your decisions about in-person versus remote schooling.
Thank you. Good afternoon. Really excited to be here to share with you on behalf of Durham Public Schools, in collaboration with our superintendent, Dr. Mavinga, and our board chair, Ms. Bettina Umstead. The collaborative has really been part of a multi-pronged approach for us in Durham Public Schools. It really helps us think through the decisions that we need to make. And they're really one piece that provides information regarding the science of the virus, which is so important as we work through and grapple with the decisions for the youngsters and our staff. They've provided lots of information to support our protocols for the learning centers that we have that serve many of our youngsters in all schools, elementary, middle, and high. They have also helped us safely reopen athletics. And part of the planning for what in-person instruction would look like. The other piece that has been an important role of the partnership is the screening process, maintaining data, protocols, transparency with the dashboard. All of those pieces have really been part of this collaboration and partnership that have helped us in Durham Public Schools.
Thank you very much. It's interesting to hear how you've been integrating the information provided by the ABC Science Collaborative in your discussions and in your decision making. In addition to that, those metrics and data and support provided by the collaborative, what are some of the other sources of information that have been important for DPS to consider in decision making?
So as I mentioned, this truly is a multi-pronged approach, and when you sit in the triangle, there are so many resources, and we really believe in the partnership. So when you think about the broader medical and public health community, including Duke Health, Duke University, projects such as Greenlight, and also we have to mention our Durham County Department of Public Health that has been a partner with us since the beginning of the pandemic. We have gotten robust community feedback. We really try to make sure that we're staying in touch with what our families are saying through surveying our teachers, family preferences, also getting information regarding ideas that they may have, and then also listening to the valid concerns that we're hearing from staff and community members. And I think finally, it's important to emphasize that, especially in Durham, but in DPS, we have just a tradition of making sure that we have robust public involvement in making decisions and really listening to the feedback from our partners as well as from our staff.
Thank you very much for sharing that. And it's such an important point to note how much you do involve community feedback in this, and really how much all of us, parents and students, as well as educators, are so eager to get back to some sense of normal in-person schooling, and just the I'm sure you're well aware of all the really difficult situations that many families are experiencing right now as they try to meet the needs of their children, not only for academic growth, but also their social and emotional growth and their mental health. So thank you so much for sharing how you involve the community feedback. I'd like to invite Mrs. Moore into the conversation now. As superintendent of the Wake County Public School System, with over 160,000 students, 191 schools, and over 19,000 employees, you're leading the largest school system in North Carolina through what's likely the biggest challenge in education in our generation. Can you tell us a bit about how you've worked with the ABC Science Collaborative and how the information and the data they provide has been used for considering options for Wake County Public Schools? And also, I just want to acknowledge, given 191 schools, you're making many decisions, not just one. And so we'd be interested to hear about how you work with the collaborative and how you think about making those decisions to try to meet the needs of students, families, as well as teachers and other school staff. Welcome.
Thank you, and thank you for the invitation. So I'll start first with the reeling that it really hadn't stopped after last spring's closure when the governor closed all schools in March. And we had just made that decision like literally a couple of hours before he announced that decision publicly as a school system, and then he did it for the state. And as we went through the spring and really had to pivot and exhibit tremendous flexibility, ask so much of our teachers and our communities, our families and our students to finish the school year. And as we were planning for the opening of the next school year and remained in the throes of the pandemic, and DHHS comes out with this Strong Schools toolkit that had tremendous information in it about the options and the requirements for schools implementing Plan A, B, or C, depending on what was allowed. One of the things that became clear as superintendents discussed this is it's one thing to provide the requirements of operating under Plan A and B, but it was a completely different and absent in the document discussion about how do you determine when you have a choice which plan you should be in. And so that was not covered in the document. And superintendents really felt themselves put in a position of having to make decisions about health and safety and metrics and those kinds of things that is not our background. And so how do we provide an informed option to our communities, and how do we use that information? Well, I'd heard about Chapel Hill working with the ABC Science Collaborative, and I mean, it was like no time at all before I sent the email and said, hey, we'd like to talk to you as well, because that was a gap. There was a gap in the decision-making process for school superintendents in terms of having the expertise and the background of those who were up to speed on the research that was emerging and changing every day, that could help us understand the data and what it did mean and what it didn't mean. And then how that data fits into the multiple points that school districts have to consider with regards to reopening for in-person instruction. Because certainly the data, the metrics, what's happening with the infection rate is a piece of it. And it's an important piece of it. The emerging science is an important piece of it. The principles that eventually came out of the work are incredibly valuable. But there are pieces that we do have to consider as well as a district that were mentioned earlier. Staffing, PPE, equipment, confidence in being in our buildings. Those were all things that we had to consider as well. So really for us, the ABC Science Collaborative filled a gap that wasn't in the Strong Schools toolkit that was a critical part of our decision-making process at the district level. And that collaboration has been very helpful. Both Dr. Benjamin and Dr. Zimmerman have attended board meetings and work sessions, provided graphs and charts and information and emails, and even engaged some of our board members one-on-one as needed, which that can be, a rabbit hole when we have 9 of them. But it's really been very helpful because as large as we are, we're going to see disparate impact in different parts of our community. We have multiple zip codes that had disparate impact with regards to percent positive in our zip codes, and we needed to understand that data. So all of this has really been a partnership that allowed us to fill a gap that we wouldn't have been able to do on our own. And really to help us with what I said earlier about how do we build the confidence of our teachers. They know that we are not the experts on the medicine, so to speak, the virus, the epidemiology. So how do we use that partnership to allow us to hear from our teachers and be able to answer the question, really shift the narrative from schools are not safe to open to how do we open safely? And I think that shift is really important in our work moving forward. And the ABC Science Collaborative helps us do that. I can't thank them enough. So.
Ms. Moore, thank you so much for that overview about the really challenging decisions that you're making throughout the pandemic and how you've relied on the expertise of the ABC Science Collaborative as one piece of that. I think what you said about having to deal with multiple points of decision making is a really important one to remember. And certainly the health and safety of our teachers are key in that, and helping to figure out ways to safely reopen is certainly a part of building back that confidence that we could do this safely. So thank you for sharing that information. I'd like to introduce now and invite into the conversation Professor Stanley Litow. As I mentioned earlier, Professor Litow is a professor in the School of Public Policy at Duke University, as well as a member of the New York City Education Sector Advisory Council, advising the mayor on reopening. So we know that schools across the US are facing similar, very difficult decisions about safe reopening. In New York City's elementary schools have reopened after a recent closure due to a surge in cases. And we know that New York City schools have started implementing mandatory random weekly testing for students, teachers, and staff. Can you tell us a little bit about your work with the New York City schools on the Advisory Council and how they're working with the New York City Health Department on some of these things we've been hearing about with the ABC Science Collaborative?
Sure, I'd be happy to. First of all, I was pleased to serve on the mayor's task force. My prior experience was as Deputy Chancellor of Schools for the city of New York back in the early 1990s. And what was presented to the schools in New York and the schools around the country was an incredibly unique kind of a challenge. And when schools shut down in March, very shortly thereafter, an advisory group was put together. And among the recommendations were regular testing, real effective about tracing, the provision of all the materials, and engagement of teachers and principals in the process. Principals unions, teacher unions were all part of the same advisory group, as well as a number of not-for-profit organizations that had direct engagement with students, parents, and the community. So the challenge was to come up with an intelligent plan. And now, after several fits and starts, they opened in a hybrid model a number of schools with a major focus on the elementary early grades and also English language learners and particularly vulnerable students, and others were largely participating through remote learning. But the testing is critically important. I mean, more aggressive testing of teachers and also testing in the schools is something that is going to go on at a higher level as the school year progresses. I'm also a trustee of the State University of New York, and we have 60 campuses across New York State. And the testing strategy is key to be able to make this work. And it's not just random testing. It's going to have to be a lot more aggressive. And I think also one of the things that New York City has learned is that remote learning is not a solution. It's an adjunct to in-person instruction. And people have focused a lot of attention in New York on the number of students who didn't have a device or who didn't have connectivity, and that was a serious problem. But perhaps the larger problem was the students who had a device and had connectivity, but they weren't accessing it, or they didn't have the supports to access it, or what they were accessing wasn't high quality enough to be able to sustain learning. So I don't think it's just about opening, and I don't think it's just about whether it's hybrid or not. I think it's a question of going through all of these various elements that school systems are being faced with. They need collaboration and support from local government. But perhaps the most important thing is the support at the federal level. And that's where the resources are vitally important and the supports are vitally important. So in New York City, I think the understanding is that schools are less vulnerable than a lot of other institutions, and that the commitment to some form of opening is vitally important, and that if that's not done in an effective way, the costs are going to be very, very high over the long term.
Professor Litow, thank you so much for those insights from your perspective working in New York City. You raised some really important points that we could continue with in the discussion. Certainly the importance of testing, the more nuanced questions about it's not simply remote learning versus in-person learning, and in-person learning looks nothing like it used to look. So that's another thing to consider. And certainly nuanced questions about certain populations that might be more at risk, who need access to in-person schooling sooner, maybe than other students who are managing okay. Really important questions about funding, certainly at the state and federal levels. So we could bring all this into our discussion with the panelists. We do have a question from our audience about the work of the ABC Science Collaborative outside of North Carolina. Dr. Benjamin or Dr. Zimmerman, can you talk a little bit about any work that you're doing with school systems or other universities outside of North Carolina?
Is this you or me? So there's about 9 states that have initiated the process of working with us at various degrees. Some of those, for example, Kansas and Missouri, where they clearly have some support already in place by their faculty, and other places where they've just started to reach out to us and are just starting to now get off the ground in any kind of way. And ultimately the model is to have a kind of a hub and spoke model would be ideal, where there's shared data, provided that it's anonymized, shared documents, provided that those are handled appropriately on, policies and procedures. And for what gets done in Missouri takes on a flavor of what gets on of what we've established in North Carolina, for example. And then for the following of the general principles, if you will, the states where it can be really the most challenging are the ones where there's not yet buy-in to masking, and how to help those states and those districts that don't have the mask mandate that we have here in North Carolina is a real challenge, because if we come in kind of guns blazing around the data, that can be counterproductive to ultimately helping those districts achieve a safe work environment, right? Because that's what we all have, that shared common end goal, that whether to have that safe work environment, whether that's this year with the current situation, next year, children are not going to be vaccinated by September. The year after that, there'll be variants that can evade the vaccine. It's going to be a non-trivial problem for quite some time. And now is not the time to torch all those potential relationships. It's a challenge.
Mm-hmm. Yeah, thank you for bringing up the importance of the mitigation strategies and how with the variations across states, how that's really challenging in thinking about reopening schools. We have a question from a participant about the status of testing in North Carolina and in school districts. As Professor Litow mentioned, they're beginning to test in the New York City schools. What about, what's the discussion around testing in North Carolina?
I can at least start on that. So as far as testing and contact tracing with regard to the schools themselves, so after perhaps there's been an exposure, people are in quarantine, schools have done a really good job of referring people to the health department and to free testing sites. We have letters from schools that go to their community members that wrote on a rotating basis, where are the free sites where people can actually have access to testing. So that's that's obviously on the opposite end of the spectrum from the things that they've been doing in New York. There probably is a place for surveillance testing in the K through 12 setting. The thing about the mitigation strategies, however, is that it assumes that everyone is infected, right? Like that's the assumption that we should walk into the door with, that everyone is infected, whether you had a test or not. Everyone is infected. Everyone should wear masks. We should do distancing and we should wash hands. With that mindset, we've demonstrated that you can be very effective because these kids are coming in and out of the school building. They're going home, they're coming back. So without there are capabilities on college campuses that are not the same as capabilities that are going to be in K through 12 campuses. Those are combined, like confined settings, as opposed to K through 12 settings. So when thinking about testing, while there is likely a place for it, perhaps in athletics, in the adapted curriculum, there might be some role in it to kind of restore trust for people in kind of the school system, but we should still assume that everyone is infected because those testing strategies aren't necessarily perfect.
That's a really good point about assuming everyone is potentially infected, and that given that assumption, the testing becomes less relevant. And I also appreciate your distinction between public schools where children are coming in and out of the school from the community, and a place like Duke with our residential students who we really can surveillance test because they're not as much interacting with the community, although we know they are to some point as well. I'd like to address the panelists, superintendents at this point. We have a question in the chat about hybrid models of returning to in-person schooling, and in particular, the challenges of bringing back cohorts of students. Can you talk a little bit about your decisions to return to in-person schooling with reduced numbers of students? Ms. Moore.
So for us in particular, the cohorts of students really are about reducing density and being able to meet the requirements of what's in Plan B option. So the Plan B option does require that we have 6 feet of social distancing, and that is impossible to do unless you reduce the density of students in the classroom. What's really hard about that is, Plan B, because districts were also required to offer a virtual option to families, we have almost half of our families who for second semester chose an all virtual option. And then we have the other half that are in the buildings. But people don't always recall that if half our families are in virtual academy, half the teachers went with them. So when you come back to the building, you have full classrooms of teachers unless you split them up into rotations. And it's a very inefficient way to use your staff, because some of those teachers may also be engaging in remote instruction for virtual academy students while they are engaging with in-person students. And I'll give you an example, like if a high school has 1 French teacher, that teacher is teaching the kids who chose virtual academy and the ones who are in rotations in the building. And that means that she is working with the ones that are in person any given rotation, and the ones that are in remote any given rotation, as well as the ones that are virtual academy. We chose to make our hybrid model a program within the school because of the large numbers of students. We couldn't take $80,000 worth of 80,000 students worth of teachers out of schools and make them all virtual, because that would have taken teachers out of our school buildings, and it just didn't work well. So the hybrid plan is inefficient. And it's a challenge for families who have to determine, so how do I support my student when they are not in an in-person week in our case? And for us, we had to partner with the YMCA to offer really low cost, subsidized opportunities and places for children to go during the weeks that they were in remote and were not in their in-person setting. So it's required partnerships outside the school system. It's required looking at resources, our human resources and our physical resources differently. It's also required really strong messaging with families around what happens when students are in person versus when they're in their remote in the hybrid piece. And it's not without its challenges. Attendance, we find, is problematic sometimes with students when they are in their remote weeks. And while we're trying to provide flexibility with that, such that a student might be able to do the work but not be on camera and still be counted present, because we know we have issues with devices and connectivity. We've pushed out 80,000 devices to our students. We've pushed out 10 or 15,000 Wi-Fi hotspots to our families, which has created a whole nother public discussion about broadband being a public utility instead of something like it is now, and the need to look at that as a community. So there's a lot of moving parts to achieving hybrid successfully, and there's room to grow.
Absolutely. So many challenges you brought up in just that brief discussion there. I appreciate what you said about the partnerships with the community. I think one thing we're all learning about education is just how important it is, not only to the children and families, but also to the functioning of our workforce in our community, and how essential educators and teachers really are in keeping everything going. The staffing challenges you mentioned are incredible as well. I know many of the families that I have spoken with have wanted to prioritize staying with the same teacher, and how hard that is when some teachers are remote versus in person, and the challenges of that. And then, looking ahead, how do we all work together to make this happen? Let's see, we have a number of questions in the chat about vaccine distribution for educators. Wondering if Dr. Zimmerman or Dr. Benjamin, you would like to jump in and provide your perspective on vaccination.
Sure, and I was just typing on this, otherwise I would have deferred. So whenever we prioritize one group, de facto, we deprioritize other groups. And there's a compelling reason to prioritize healthcare workers, even though we're not getting infected when we're at work, because we do universal masking, and that's true if we're in the hospital or if we're at the health department. But the compelling public health reason to vaccinate us is that without healthcare workers, there's no one to save the lives of who is infected. Okay. For other essential workers, when I vaccinate an essential worker, I help them and their family, and that's good. For the school staff member, the compelling public health value add is that when I vaccinate the school bus driver, I'm helping not only that school bus driver, I'm helping the 30 children who are on that school bus, and then their families as well. So, I know that folks struggle with, hey, if we prioritize one group, we're going to deprioritize another, but there is a special compelling public health value add, if you will, a force multiplier in public health, if we prioritize school staff who are working in person. Now, that rationale, of course, falls apart if the staff are not working in person. It's the people who are working face-to-face.
Mm-hmm. Yes, thank you very much for weighing in on the question of vaccination, which many people are following right now as North Carolina rolls out its plan. Let's see, another question that we have is about the impacts of the pandemic on education going forward. Another big, broad question. I want to see, Dr. Hardy, maybe if you'd like to weigh in on what do you see as some of the impacts of what's happening in Durham on the students and families, and what the school district is thinking about in moving ahead.
Thank you. I think, one of the biggest challenges that we have seen and impacts would just be around isolation. Learning has become so social and engaging, in that in the virtual and even in the hybrid setting, there are there's more isolating times for our youngsters, as well as just the lack of social opportunities and the support for social and emotional well-being. And so those are the pieces that I think, really do have some of the biggest impacts. We also want to make sure that in all of our communities that the partnerships and the cohesion and coordination is something that is really important. And I think we've had to lean on our partners given the pandemic to make sure that we're providing as much support as we can during virtual learning. We in Durham Public Schools, we really want to make sure our families and our community know that you don't have to go it alone, that although we are separated, we are here with you. And I know, our partners and other school districts are doing the same thing, and, making sure that we're providing support in the community, making sure that our feeding sites are available, really trying to make sure that we are providing that support. But I do think we have to acknowledge that isolation is something that has been an impact given the virtual learning.
Yeah, thank you for bringing that into the discussion. The isolation certainly is impacting children and families. And one of our participants was asking specifically about social emotional growth and learning. And I think that addresses that. Dr. Hardy, can you say a bit more about the learning centers that Durham Public Schools is supporting? We haven't had a chance to talk much about that. And I think it speaks to your point about trying to reduce the isolation that many students are feeling.
I think acknowledging that this pandemic has not just affected our youngsters, it affects families and communities. And while we have been in virtual learning in Durham Public Schools Plan C, we have provided learning centers through our partnerships. So we have some that are on site, and we also have some that are within our communities. And the learning centers really are an opportunity for us to provide a safe space for youngsters to access virtual learning, so that many of our families have returned to work and are not able to provide supervision for youngsters. And we want to make sure that they have a safe space where they can learn and access virtual learning. We've also, that provides an opportunity. All of our students do have access to a Chromebook, but that stable internet that is so important. We provided hotspots to our families. But just making sure that the basic needs are there so that our youngsters can access the virtual learning. We have 4 DPS learning centers. We also have learning centers that are through a Hope Network partnership within the community with the DPS Foundation, Student U, and the YMCA.
Again, the importance of community partnerships in addressing the needs of children and families during this time. I think both you and Mrs. Moore now have brought up the necessity of broadband access as a public good and how essential that is to our students. We knew that before, but needing to access remote learning has really highlighted the situation and the need that every family have access to Wi-Fi as well as a device for accessing educational materials. In thinking ahead to the fall and the 21-22 school year, what do you see as some of the opportunities and challenges? And Dr. Fowler, if we can go to you on this one to start, as a pediatrician, as a former school board member, as a county commissioner now, what are you thinking about for the future in education?
Thank you. Yeah, I was just going to comment on that last question. As a pediatrician, I'm seeing much less colds and flu this year. I diagnosed my first ear infection ever, thanks to all the isolation. But unfortunately, we are seeing tons of, anxiety and depression, which, is going to be one of, it's currently a challenge, but will be an ongoing challenge. I think also dealing with learning loss. So I think there'll need to be funding for summer schools or extended school year type issues. And then clearly, as I mentioned earlier, we're still going to be negotiating likely hybrid models plus virtual, which, as Ms. Moore pointed out, as inefficient, and you have intensive protocols that we have to be working with. And the pandemic has, pointed out these inequities, such as the lack of broadband. So, on the bright side, the fact that it's, come to our attention, hopefully means we'll be working on those issues, now. And now that I'm a county commissioner, we just appointed a broadband task force to try to increase broadband in Orange County and advocate on the state level as well for that. So, and then, clearly, I think virtual learning can't, hold water to in-person learning for things like science and band and theater. But I do think districts now have this as a tool that they can incorporate into, their learning repertoire. So those are a few opportunities, I guess it's brought.
Mhm,
I'll
mhm.
leave room for others to comment.
Yeah, thank you. Thank you so much for sharing that. Although I could tell you, I bet lots of students are cringing at that thought of continual virtual learning in the future. As many of us who are growing weary of Zoom meetings instead of seeing people face to face, but I do see what you're saying there. I'd like to invite Mrs. Moore to jump in here about thinking ahead to the next school year and what maybe lessons you've learned or things that you've been thinking about in terms of this year's experience in planning for next school year as well.
So I think that it's important to note that as we move forward, last year the state exempted schools from needing to administer and of course end grade assessments because of there wasn't even a requirement that we offer virtual learning for students at the end of the year last year, and some districts were never able to stand that up. This year, all districts were required to have some sort of virtual opportunity. So we've not been exempted from, and that requires some federal waivers as well with regards to testing and accountability. But I think for me, it is not that we don't want to see what assessments might say about what our students have learned or where those gaps are this year. But I think it's important to note that the consequences associated with how students perform on these assessments really should be off the table, because we know we know that we have students that have not accessed at the same level as others, and there are lots of reasons for that. We also know that you could even call into question how every teacher has been able to transition to being a remote instructor versus what they were trained for in the classroom, and that there are gaps there. We required all of our teachers to take training at the beginning of the year in order to be prepared to be remote teachers, but that's still not the same as having the time to implement and the experience behind you to do it. We continue to get better every day. We'll be better next year for those who want to be remote than we were this year. But those gaps are there even in how our teachers have approached their craft. So we have disparities. We had them before the pandemic. I think some of them may have very well been exacerbated. We've shown a spotlight on them during the pandemic. And I think really we have an obligation as a community when we come out of this pandemic to not go back to how it was. If there ever was an opportunity to revision, reshape, reprioritize what our needs are and how we creatively and outside the box and all of those other kinds of terms approach education for students, it is now. But we're going to need to have the support of our community in order to do it, because we knew before the pandemic that students not having access to broadband could very well inhibit their ability to engage in homework, in review, in support when they walked into their homes in the evenings. But it wasn't a house on fire like it is now. And I don't want that to go away just because our students end up back in the building, because otherwise we are accepting that gap between school and home. And those are the things that we've got to attack and change as we move forward. It's going to take years to really sort of level set back where we were. And even then we want to be better than that. So we really need to take advantage of the fact that this has been such an incredibly difficult task for our teachers, for our communities, for our parents, for our students, and use it to shape a better path forward for our schools and our students, in particular those who have been marginalized for longer than since the pandemic has started.
Very, very well said, and such important points there about this potentially being an incredibly transformative time in education, and the opportunity that the spotlight on these provides for us, and that really there is not a desire to go back to exactly the way things were for sure, but to make things better. And I feel like that could be a really great next session with all of you, such wonderful leaders and thinkers in our community. I really appreciate you participating in our session today and sharing your insights and your work. And I just want to congratulate all of you for the partnerships that you formed and the amazing work that you're doing to support students and families in our communities. I'd like to ask each of our participants to click on the link in the chat to take a quick feedback survey to let us know what you thought of today's event. And I also want to take this opportunity to announce that on February 24th, Harvard economist Raj Chetty will be speaking with us as part of our Distinguished Lecture Series about how using big data can help us understand how we can give students from disadvantaged backgrounds a better chance of succeeding. So please join us for that event as well. Thank you again to our presenters, Dr. Zimmerman and Dr. Benjamin, and thank you to all of the panelists. Very interesting and important discussion. Thank you.